Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we have come to the fourth part of our hair fall series, that is Alopecia Areata. So why are we discussing about Alopecia Areata is that this is a autoimmune condition primarily because one autoimmune condition can trigger other autoimmune conditions as well. And secondly, there is potentiality if we treat this condition properly for the hair to regrow back. And also 1 in 1,000 people all over the globe have a common susceptibility for this condition to be developed. So we need to discuss this in detail. So let's dive into the topic. What is alopecia areata? So alopecia areata means a chronic. What do you mean by chronic? Chronic means more than 6 weeks and acute means less than 6 weeks. So it is more than 6 weeks. So it's a chronic autoimmune condition. What is autoimmune condition? Your own body is attacking your own body cells mistakenly. So that is autoimmune condition. So it's a chronic autoimmune condition which leads to, if you see the picture, you can see that it is having patchy hair loss. So patchy hair loss predominantly on the scalp, or it can occur anywhere on the body where there is hair. Okay. So what is alopecia areata? It is a chronic autoimmune condition which occurs having patchy hair loss condition, typically on the scalp or anywhere on the body, where the body is mistakenly attacking the own body system because of immune failure. Now let's get into the signs and symptoms of alopecia areata. First, as you can see here in the picture, what is something that you all notice? That is patchy hair fall or patchy hair loss along with bald spots. This is the characteristic feature of alopecia areata, which is patchy hair loss, that is hair fall is in patches leading to bald spots all over the scalp. It can occur either on the scalp or anywhere on the body where there is hair. The second symptom is trichodynia. What is trichodynia? Trichodynia is a symptom, not a sign. All of these can be considered as signs where you can see it, but the trichodynia is a symptom peculiar to each person. See, in the starting section, or if you take the hair root, many people will feel burning sensation. Some people will have stinging sensation. Some people have just pain when you move the hair or when you touch the hair. This is called as trichodynia. It is particular to different individuals will present it in different manners. Some with burning, some with stinging, some with pain, some with different sensations. Next, there is depigmentation of hair. See, depigmentation of hair is a common characteristic occurring in alopecia areata, or it can occur in telogen effluvium, male and female pattern baldness also. Why does this depigmentation of the hair occur? If it is causing or is triggered by nutritional deficiencies, this hair depigmentation can occur or it can be triggered. Next, inflammation of hair bearing area. Any area that the immune system is attacking, it can be scalp or it can be body. The starting stages, that is the hair root, is inflamed. What do you mean by inflamed? You will see redness, you will see swelling, you will see heat, you will see pain in that area. That is inflammation. And then coming into the last one, lesions appear suddenly and expand suddenly. That means there are some phases where you are feeling much better, there is no patchy hair loss, and then suddenly, because there is some sort of a trigger, it's an autoimmune disease, remember. So there are triggers for this autoimmune disease. It can be anything. We will discuss about the triggers in the causes section. So it can be any sort of trigger. When the trigger occurs, there will be sudden hair fall, sudden patches, sudden bald spots, which can expand rapidly, and then they can come to a standstill. And then again, when there is another trigger, they can again start and expand suddenly. So this is also a common feature of alopecia areata. What are the other signs and symptoms? See, remember, alopecia areata does not only have hair symptoms, it also has nail symptoms and overall systemic symptoms. So what are the nail symptoms? In the nails, we can see pitting, roughness, thinness and splitting and white spots. What are all these symptoms? We'll just see and check out the symptoms with visualization. As you can see here in the picture, can you see small pits on the nail? That is called as pitting. That is, there are deep indentations on the nails. And then you will see that the nail is cracked because it is splitting, it will be thin, the nail health is deteriorated. Whenever you are healthy, the nails that you grow will also come stronger and also will be thicker if you see the thickness of the nail. But when you are anemic, when you are having iron deficiency anemia or any sort of nutritional deficiencies, or if you are having any sort of autoimmune diseases, You will see that the nails are thin, they are brittle, they break very easily. So that condition can be found here. There can be splitting. What do you mean by splitting? There will be, the nail will start to crack from here to the topmost part. That is from here like this. It will start to crack. And then here also there will be cracking and splitting of the nail. Okay, there will be indentation. And not only that, what else do you see here is that you will see spots, you will see thinness, and you will see roughness also. So if you touch, the nail should be smooth, right? But it will be very rough to touch because of the indentation. These are the nail symptoms that you have to note. See, remember, primary to hair fall, many people will have these nail symptoms, starting stages, where the nail is becoming very fragile, easily it is breaking, it is splitting, you will have small, indentation. Some people will have ridges on it. So your nail health will tell you overall how your health is. So please do take care of your health and also note how your nails are. Every day just have a look at them, how they are. If there is any sort of problem in the nails, regarding the symptom, like if it is ridges, there is certain section of investigations that you have to do. If there are indentations, there is certain section of investigations that you have to do. So do consult a doctor if you have any sort of nail symptom. Then what are the overall systemic symptoms that you will be having? You will be having pain wherever, if it is especially affecting body hair, there will be pain in every follicle in certain section of people. There can be itching, there can be tingling, or there can be burning near the skin area wherever it is being affected, or overall also the skin can start to burn. Now let's get into the investigations part. If you're suffering from the signs and symptoms you have already mentioned in the previous section of this video, you have to take a doctor consultation. And while you're taking a doctor consultation, the first thing that the doctor would do is take a visual inspection of how the bald spots are. He will note down the history, if there is any genetic factors, the causes and risk factors, how your representation is, what are the symptoms that you are personally facing or individually facing, so that he can come to a diagnosis. And through visual inspection and through history, if he is not able to come to an diagnosis, there will be certain investigations needed. What are those investigations? Primary thing is physical investigations that they do. First one is the pull test and the tug test. If you have seen our previous hair fall videos, you will be knowing that this is a common physical examination test that the doctor does on the patient to know if he is positive for hair fall. First one, as you can see here, is the pull test. They will take a section of your hair and start to pull it. Okay, and when they're pulling it, if 2 to 3 hairs normally come out of that section, then that is normal. If more than 6 hairs are coming out of that section, then that is excessive or positive for hair fall. And the second one is called as the tug test. So what is tug test? See, as you can see here, this is the common physical examination test that they do if you are positive for hair fall or not. They take a section of your hair. By pulling it, it is called as pull test. If they are pulling the hair starting of it, okay, hair root. If they're pulling the midsection of it, as you can see here, if they're pulling the midsection of it, if there is any broken hair, more than 6 hairs are coming off, then that is positive for tug test. See, tug test is positive when there is thinning of the hair and then there is no lustre or thickness in the hair, it starts to break off. So if these 2 tests are positive, that means you're positive for hair fall. Then what is the other test that they do? See, these both come under physical examination. The other one is with the instrument that is called as trichoscopy or trichoscope. They do this trichoscopy where they will see the thickness of your hair, how your hair is built, how thin it has become, and how are the bald spots. So this is trichoscopy. This is done through a machine or an instrument. Apart from this, there are other investigations. Let's look into it also. The other one is called as card test. What is card test? They take a white card and they put it under the section of your hair. They put it here, especially near the hairline, and to see if there are any broken hairs or baby hairs starting from that bald spot, or if there are any broken hairs coming or arising from your scalp. So see, as you can see here, these are the long hairs. As you can see, these are going this side. These are the broken hairs. If there are a lot of broken hair, it means that the hair fall is again stopping and new hair is growing. Okay. And then what is the next test is that it is called as wood lamps test. This is very specific for fungal type of seborrheic dermatitis, or if there are any scalp infections. Under the UV light, what happens is, normally if you are viewing with your naked eye, it is like this. It is just inflammation. You will not see any sort of fungal appearance here. But under wood lamps test or under UV light, if you see, Can you see here it is glowing, this part? So it is positive for fungal infection. So this is also one of the tests to eliminate any sort of fungal infections you're having in the scalp. And the other one that they do is the scalp biopsy. What is scalp biopsy? If after performing all of these tests also you're not able to assess how the hair is, they will do a scalp biopsy. They will punch out the scalp a little bit and then they will take that section and under microscope they will be viewing it for any other diseases. Now coming into the structure and function of the hair. See, if you know the structure, the function of the hair, you will know where it is going wrong and how it is going wrong. So you will be able to counteract it with certain precautions. So let's get into the structure and functional part. So if you're seeing here, this is the epidermis part as you can see, and through the epidermis part you will be able to see the shaft of the hair. Okay, and then this part is called the dermis part, this whole part, and from here itself the hair will arise. So what happens? See, as you can see, there is blood vessel going in and out. If there is any problem in the body, there will be differences in the blood as well. So if you are having some iron deficiency, if you are having any sort of problems, even the attack, that is WBC, if there is any bacterial infection also, the WBC travel through blood itself, right? So what happens if there is any infection or if there is any problem, all of this will cause changes in the blood, and changes in the blood will have an effect on the growth of this hair. Okay, so any problem in the blood will have effect on this. It can be autoimmune disease also. So what is autoimmune disease and how the effect will be there? Why are we talking about blood here? I will let you know in the body changes part, but just remember that the dermis part will have the blood circulation. So if the blood circulation does not have, if it has poor quality of blood, then the hair will not grow properly. Even if there is any inflammatory mediators, that is under certain infections, there are inflammatory mediators released into the body, which tell that you have to fight for certain things, and during that fight there are certain byproducts releasing. So that byproducts will also cause harm to the body. So all of this is going on and it will be reflected in the blood and from the blood to the hair follicle. So this is the basic structure of the hair, where it is arising from the dermis. The shaft is present in the epidermis, and you will see that the hair outer part is made up of cuticle. As you can see, the cuticle is the protein part. So if there is any protein deficiency also, the hair will start to thin out. So this is the basic structure of the hair. So inside this cuticle you will be having cortex and medulla. If there is no proper nutrition, this hair will become very thin. Okay, and also the number of hairs developing also will be very much reduced. Apart from this, what is something that you should know? See, the hair is, especially like females have menstrual cycle or body has certain cycle or circadian rhythm. In the same manner, the hair also has certain cycles. That is, first cycle is when it starts to grow, it will be in the growth phase for 2 to 8 years. Okay, second phase is the regression phase. After it has grown for a certain period of time, it will go into the regression phase for 2 to 3 weeks. Okay, that is, there is no growth, there is no falling. Third phase is called as the falling phase, which occurs in 2 to 3 months. Okay, so whenever you're pulling your hair, any hair that is in the falling phase will come off. So usually 80% should be in the growth phase, 10% in regression phase, and 10% in the falling phase. But if you're pulling your hair and more than 6 or 10 hairs are coming off, that means a lot of the hair has shifted from healthy growth phase to the regression or to the falling phase. If they're coming off, that means they are in the falling phase. That means hair is not healthy. There is some sort of problem going on near the hair bulb. So that is why when you pull, it is important to note number of strands that are coming off. And also when you're combing, it is important to note if it is more than 100 or 120, so that you can do an analysis by yourself. If there is more number of hair falling, that is more than 120 number of hair falling from your head, that means a lot of changes have happened in the hair and it is shifting from growth phase to the falling phase, which is a dangerous sign. Now let's get into the causes and risk factors. Remember that, as I told you, it is an autoimmune disease. What is autoimmune disease? Autoimmune disease where our own body fighter cells do not recognize our body cells. They think they are foreign body members and then they fight it and start to destroy it. So this is autoimmune disease. So what are the triggers for this autoimmune disease? The first and foremost trigger for any autoimmune disease will be genetic predisposition. So genetic predisposition, if your mother or if your father or if your primary siblings, your grandparents are having autoimmune diseases, every chance, like you will have 10 to 20% more risk than other people. So genetic predisposition is very, very important in having or getting this autoimmune diseases. Apart from this, if you don't have any sort of family history also, will you develop an autoimmune disease? Yes, there is certain risk that can cause this autoimmune disease. What is that? The first thing is environmental factors. See, we are not living in a healthy environment these days. It has pollution in it. It has pollution of all sorts. Water is polluted, food is polluted, hair care products are polluted. Everything is polluted with chemicals. So this can cause trigger in certain section of people leading to autoimmune diseases. Other than that, what are the triggers? Unknown triggers. See, these unknown triggers, the primary culprit will be stress, as you can see here in the picture. See, if you can see here in the picture, this is alopecia areata we are taking. Okay, the genetic history we have already talked about, and we are talking about stress, which is an unknown trigger. Stress of any sort. It can be physical, it can be mental. Okay, mental means emotional stress. If you are having too much of work, no proper sleep, if you are not having proper sleep, that will cause your gut bacteria alteration, where there are nutritional deficiencies. You're not taking proper food also, and even if you're taking proper food, it is not being absorbed. So all of this, that is, nutritional deficiencies because of stress. And then you're having any sort of local skin disorder, any skin disorder that can also trigger it. And also systemic illnesses like HIV, like cancer, psoriasis, psoriatic arthritis, SLE, all of these can also trigger this alopecia areata. People are already suffering from rheumatoid arthritis, all of this stuff. Any autoimmune disease can trigger or make way for other autoimmune diseases. And then post-acute illness is also very important. Post-acute illness means after a sudden illness, your body is physically stressed out. Mentally, that means your work-life balance is not good, you're emotionally not in a good place. But physically, any acute systemic illness or any acute illness, like it can be viral, it can be bacterial, from that on, your body is physically stressed out. That is the trigger for the hair to fall out in bunches. That is physical trigger. And stress can lead into improper food consumption, leading into nutritional deficiencies. And these nutritional deficiencies can also affect the hormones, and the stress also can affect the hormones. If you're very, very stressful, what happens? There are fluctuations in your cortisol level, in your estrogen level, if you're a male, in your testosterone level. So there can be fluctuations which leads into alopecia areata. So stress is the main culprit apart from genetic disposition. So if you're having stress, even minor environmental problems like just normal smoke, or even just light, or even just some sort of dust, can cause a severe reaction in the body if your body is under stress. So make sure you are emotionally stable, because if you are emotionally stable, physically the body will represent that healthy nature. So you will be able to get out of even acute illnesses as well. And then if you're using certain medications and you're suddenly stopping them, it can be thyroid, it can be hypertensive medications, it can be your diabetes mellitus medications, it can be your arthritis medications, it can be your steroids. Anything you're suddenly stopping can also cause a trigger. So all of these are causes and risk factors for alopecia areata. Now let us get into the body changes part. See, remember, as I told you, alopecia areata, or it can be anything. Usually, if you're explaining it in medical terms, many people are not able to understand. So we are breaking it down for our patients so that they can understand much better. So remember, as I told you, we have epidermis, and we have dermis, and we have the hypodermis. Okay, this part if you're considering as the hypodermis, this whole part you will be considering as the dermis, and this part you will be considering as the epidermis. The hair will arise from here, as I told you, right? And the hair will have three phases. That is the growth phase, then it is the regression phase, and then it is the falling phase. 80% should be in growth phase, 10% nearly should be in regression phase, and 10% should be in the falling phase. Okay, so what is happening in this alopecia areata? As I already told you that there is blood vessels supply for the hair. See, the blood vessels come here and they supply and they go. Any problem in the blood will have an effect on the hair bulb. We already discussed that. See, what happens is any sort of trigger, it can be because of systemic illness, any sort of causes and risk factors that we have already discussed in the previous section. What happens is there are WBC, that is white blood cells, and in those white blood cells we have neutrophils. Apart from this, we have the fighter mechanism called as B cell and T cells. Okay, these are three different kinds of cells that you should remember. The neutrophils, okay, in the WBC, T cells and B cells. Here it is T cells. Okay. So what do these T cells and these neutrophils do is that these T cells especially, they should recognize the bacteria. If this is the T cell, okay, and this is the bacteria, and this is the normally shaped cell. Okay, this T cell should recognize this bacteria, should consume it and should kill it. Okay, so that is the whole process. But what is happening, this T cell is mistaking this normal cell for a bacterial cell. So that is why here in the hair bulb there will be some problem where the T cell will think that this hair bulb or the cells in the hair bulb or the bacteria or different types of pathogens, and they will start killing it. That is why here it is converted from the growth phase, it is converted into the regression, from regression to falling, and completely it will fall off. If there is no care taken for this fighting mechanism or this improper mediation of the immune system, then the hair will start falling in bunches. Now coming into the conventional treatment part. So in the previous section of the video you have seen where the problem is. So if you're going to a trichologist or to a dermatologist, so here what they will be doing is, first thing they will be giving you steroids. Why? Because this fighting will cause inflammation. So that is why there is pain near the hair root or redness near the hair root. So to suppress this inflammation, they will be giving you corticosteroids. It can be topical corticosteroids, it can be corticosteroid injections or systemic corticosteroids. You know, like I don't have to explain it to you in detail, you know the side effects of corticosteroids or steroids as such. It can cause weight gain, it can cause hormonal fluctuation, it can cause lot of disturbances in the body itself. So here they are just giving steroids to suppress the inflammation. They are not addressing the inflammation. As soon as you stop the corticosteroid or as soon as you stop the steroid, what will happen? It will again start. Okay. And next thing, apart from this, where is the other problem is you're having problem in the immunity. So what will they do? They will give you topical immunotherapy or they will give immunosuppressants, all of these. So what will happen in immunosuppressants? They're suppressing the body's natural capability to fight, so that this abnormal viewing of the normal cells will be stopped and the problem will be taken care of. But remember, immunosuppressants can lead to other problems. What are that? See, for example, you are taking medication for your hair fall, that is your alopecia areata, either on the scalp or on the body. What is happening? You're taking immunosuppressants and you're putting on corticosteroids. You're gaining weight, you're losing your immunity, and even normal bacteria, which is usual to the surrounding, can start affecting you because you're on immunotherapy or immunosuppressant therapy. Any little thing can cause a lot of reaction or can cause infection. So that because there is no, immune cells are not recognizing it and are not fighting it because of the immune suppression going on. So this is not a proper way of treating, because we are just suppressing the natural immune system for vital organs. We are not giving protection. We are just taking care of the hair here, but the vital organs can get affected if there is a lot of infection. The other thing is minoxidil. That can be oral JAK inhibitors or other treatments like PRP. All of this they will have effect on you, but when you stop it, when you stop taking this minoxidil, or when there is poor blood quality, what will you do with the PRP therapy? There will be no result. See, after stopping minoxidil, the baby hairs which have started to grow will fall off if you are not addressing the cause, that is immuno problem, or it can be stress, or it can be hormonal disruption, anything. Here the cause is not taken care of, there is only suppression. So that is very, very important that you should remember. Other than that, what do they give? As I told you, PRP camouflage techniques means if you have lost a lot of hair, they can give you some hair samples like hair wigs, so that you can put it on, so that you will not have any sort of social stigma, going on in your brain, where you will feel very low psychologically. Everyone, no matter who they are, will feel low if there is no hair or there is patchy baldness. So to combat that, they can give you camouflage techniques. They can be cyclosporin or anthralin or this PRP therapies, all have the same effect. If you stop using it, there will be again reoccurrence of this alopecia areata. See, if you're facing alopecia areata or any hair fall for that matter, so why should you choose homeopathy and not the conventional form of treatment? Let me explain to you in 3 to 4 points to make it easy. First thing, if you're taking conventional form of treatment, it can be corticosteroids, it can be minoxidil, it can be PRP sessions, it can be any other sort of immunosuppressants. What you're doing here is you're suppressing it. You're not addressing the cause. You're not addressing the trigger. You're not addressing the immune mechanism that is going wrong. So, and there are also side effects attached to it, like corticosteroids will have weight gain, immunosuppression can cause infections, and all of this stuff. But in homeopathy, you can prevent all that. It is utterly safe to use, it does not have side effects. It also addresses the cause without causing any other damage to any other organ. Like if you're taking immunosuppressant therapy, if there is infection, your lungs can be affected, your stomach can be affected, anything can be affected, right? But in homeopathy, we are just giving medications for your hair fall where there is increase in immune function. So immune dysfunction is decreased and immune function is increased, where this recurrences of this alopecia areata can be reduced, and also it is safe, effective, individualistic. That is, if you are suffering from stress, we have different kinds of medicine. If you are suffering from acute illness, after it has started from after acute illness, there are different kinds of medications. If you are suffering already from some conditions like rheumatoid arthritis, we have good medications to treat that, as well as your hair fall. Psoriasis, we have good amount of medicines in homeopathy. So we can treat autoimmune diseases as well as your hair fall in a better, safe and healthy manner. So choose homeopathy if you are suffering from any of these. Coming to the precautionary part, which is very, very important. If you are suffering right now from hair fall, or if you want to, take care without preventing hair fall, you want to take care so that you don't want to face this hair fall, what are certain precautions that you have to follow? Proper nutrition, very, very important. See, as we have shown in the picture here, divide your plate into 4 parts. First part should be your greens or the vegetables. The second and the third part should be your protein. It can be vegetable protein or it can be animal protein, that is vegan protein or animal protein. And the fourth part should be a carbohydrate, that is whatever rice you're eating, chapatis, rotis, bread, anything will come into your carbohydrate section. If you're dividing your plate like this and eating every 3 meals that you're having, that you're taking, that is your breakfast, your lunch and your dinner, if you're dividing like this and eating, you will not face, or you will reduce the risk of facing hair fall. Other than that, stress management is very, very important. If you're in too much of mental or emotional stress, try taking a counseling session. Apart from that, try doing yoga. Stretching is very, very important for stress management. Try stretching, as well as try doing pranayamam or breathing exercises. Try walking in different locations so that you will feel the freshness, and also your stress will be coming down. If you're having physical stress, like after an infection you are having some sort of stress, that is immune reaction after an infection, make sure you take nutritional supplements properly, and also good food. Good sleep is also very, very important for physical stress as well as for mental stress. Do not choose anything very abrupt for your hair which will affect your hair. Understand the hair, understand your scalp, understand your condition and use. And then avoid unnecessary styling, which is very, very important. Avoid blow dries if your hair has started to become really thin. And then treating the underlying condition, which is addressing the cause. It can be autoimmune disease, it can be stress, it can be physical stress, it can be genetic predisposition, anything. Trying to treat it is very, very important, because it can go into a bad prognosis. And then sun protection. Remember, hair is not for aesthetic purposes, hair is for protection. In the structure, we have told about structure, but what is the function? It is thermoregulating. That means it is helping in regulating the body temperature. Whenever you are going out, your hair is the one that is protecting your scalp directly from the sun's rays, that is from the UV rays. So if you're not having hair, if you're having bald spot especially, and if you're having autoimmune disease and you're going into sun, that can trigger a lot of inflammatory condition. So try protecting your hair, because that is especially needed. And sun protection is really important if you're suffering from psoriasis, if you're suffering from any sort of hair fall, as it can trigger more hair fall. Try using physical barriers like caps or umbrellas or scarves. Coming into the neglect part, what happens if you neglect this alopecia areata? First thing, your hair will start to fall off really badly, and you can have bald spots on your scalp or on your body, and that can go severely where you can become completely bald. But that is not the problem. The problem is the autoimmune disease. If this is triggered too much, it can cause a bad reaction overall in your body. So it can cause other autoimmune diseases also to appear, like SLE, psoriasis can be triggered, rheumatoid arthritis can be triggered, other autoimmune diseases also can be triggered, and this autoimmune disease can also go into the worst. So please consult doctor if you're suffering from alopecia areata. If you're watching this video, if you're suffering from any sort of hair fall, it can be male pattern baldness, female pattern baldness, it can be telogen effluvium, it can be alopecia areata, it can be alopecia universalis or alopecia totalis, anything, and you are looking for cure, here at Fidicus Homeopathy, we have two options. One is the online consultation option if you are staying far away from us, and the other one is in-person or offline consultation if you are staying near the nearest branch of Fidicus Homeopathy. So in online consultation, we have two options. One is the audio consultation, the other one is the video consultation. After the consultation, if you need any sort of investigations, we will let you know. If you have any sort of investigations, you can share it with us. And after this process has come to an end, we will be sending you medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. If you're staying anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, message us, or ping us on this number. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're suffering from hair fall, male pattern baldness, female pattern baldness, telogen effluvium, alopecia universalis, alopecia totalis, alopecia areata, any hair fall problem which is regarding to the hormonal fluctuation, any hormonal problem also. If you're looking for cure, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy for highest chance of health. Here we follow three principles. First is, already the cases that we are dealing have a high success rate. The transparent treatment, that is, there is no gray area between the patient and the doctor. We will be talking to you about your prognosis as well. And the third thing, that is the personal care here at Fidicus, is top notch. If you have any sort of queries, if you have any sort of doubts, we will be clearing you on that as well. If you want to choose cure, choose Fidicus Homeopathy. Thank you.